So once again, I welcome all the participants and today's speaker for this third online scientific session. Already we had two successful sessions and we had good response from all the participants. So we are continuing this scientific sessions in online mode. And already the presenter of today's topic, already we are familiar with him. He was our last speaker also. He presented about the role of publications. So we are very delighted to have him again, so soon again. And we are really thankful to him for his interest shown in educating all of us and enlightening regarding these different topics. Just a minute. So Dr. Upendra Srinivas, consultant pathologist and hematopathologist and managing director of Quantum Specialty Diagnostics, Visakhapatnam. And today's topic is what next after MD pathology. I think it's a very interesting topic because it's many people will be benefited by this, the information, and especially all the fresh pass out postgraduates or who are about to come out of this. And it's guidance for everyone regarding this, our professional career and what different opportunities we have. So already we know about our today's speaker, but just for those who have joined for the first time today, who were not there before, I will just briefly tell about today's speaker. He is the alumnus of Andhra Medical College, Visakhapatnam, and did his post-graduation, in MD Pathology from PGI MER Chandigarh, and DM in Hematopathology from AIMS New Delhi. He worked in leadership roles and laboratory directorship in several national and international tertiary care hospitals, and also oversees all the lab specialties. He's a regular faculty in national and international conferences in pathology and lab specialties, and active editorial member in several journals in lab specialties, and is one of the executive committee on several pathology associations and has more than 40 national and international publications in national and international journals to his credit. And currently he is the senior consultant pathologist and hematopathologist and the managing director of at Quantum Specialty Diagnostics, which he recently established in this city of Visakhapatnam. And so with this, I present today's speaker, Dr. Upendra Srinivas, sir, who will be presenting today's topic. So as I told already, today's topic is to be lecture about the what next after MD pathology, about the various aspects of career guidance and all the opportunities which are open to us once we come out of this, PhD post-graduation and become a qualified pathologist. So, okay. Now I request Upendra Srinivas sir to please start his presentation today. And I request all the participants and especially postgraduates to please, you can have a very good interaction, thorough interaction, which our speaker also wants. He wants and expects a good interaction by and questionnaire questions from all the postgraduate students especially, and also from everyone. So let us have a good interaction with him after the end of the presentation. Sir, you can now share and start the presentation, sir.
Yeah. Thank you, Dr. Kiran. That was for that excellent introduction. Good evening, all of you, and it is so nice to be back again. I hope the last session you have enjoyed, but I'm a little disappointed that there was not much of active participation from the postgraduates. Wherever I talk, my main audience of interest is usually the postgraduates. And this time, don't take this as a presentation or something, just take it as an informal discussion. That's what I would want to have this presentation to be conducted. In fact, when I met a few of the faculty members of Andhra Medical College and other places, in fact, what they have actually suggested to me is that have an informal discussion with all the postgraduates, more so with the fresh trainees, because they are the ones who just get into the training clueless as to what is there that lies ahead in their future. So it is basically aimed at that kind of an audience. So feel free as and when you have any point to make or any query to get resolved, please raise your hand and keep asking me questions, because this entire exercise is actually meant for you. And so keep this as an informal discussion, not going to be a presentation. I've not made much slides also, because I just want to share certain of the aspects which are actually not told during the training in any of these medical schools. So I would like to have this discussion in a very interactive way. So feel free to stop me at any point, and then if you have any query, I'm sure the moderator is going to allow you all that liberty to pose any of your questions. So let's be very honest and open when we are having a discussion like this, because this matters to our careers. Actually, this is what something which you are going to live with for the next 20-30 years of your career. So if you take a cross section of pathology trainings, at least in my experience, what I have seen in most of these PGs have joined not out of their choice, but out of chance, because that's the only thing that they were getting, and that is the reason why they have entered into pathology. I'm sure most of the PG trainees also will agree to it. Though there is a good amount of residents who have joined out of interest and passion for the subject when they're doing that subject during their medical school training. Having accepted that, once you have committed and you wanted to be a pathologist, then you have to pursue that path. And you have to figure out what your future is likely to be, so that you will have a decent amount of planning and understanding of what is going to be there for you ahead. So you need to be very clear. Once you have committed yourself that you want to pursue, there's no way that you can go back and change your direction and want to do something else. So once you are committed to that, start developing the passion for the subject. It is no less a subject if you compare it with any other specialties. And in fact, my next topic is going to be pathology in the next 2 decades. How is it going to transform? Take it from me, it's going to be so glamorized that it is going to become one of the most sought after specialties in the entire medicine. As I told you in the last presentation, pathologists are nothing but consultants. Without pathology, as somebody was telling, without pathology, there is no medicine, because unless we diagnose, we can't treat a patient. So even in the textbook of Boyd, the first line you get is, as is your diagnosis, so is your practice. So if your pathology is strong, even for a clinical discipline, if you make a proper diagnosis, then you're going to properly treat the patient. So with that, you have to concentrate, focus, and develop and passion in the specialty. Once you do that, it is not something that.
Sir, sorry to interrupt, sir. Sir, can you share the full screen, sir? It is not in full screen mode.
Okay, now I think I am full screen. Can you see the full screen now? Hello?
Just a minute, sir.
Yes, sir.
Yeah, I think yes.
Was I audible till this point?
Yeah, you are audible,
but voice is not clear.
Voice is not clear. I don't know. Now, how is it now?
Okay,
is this
sir.
Now? Is this fine?
It's clear, sir.
Okay.
Okay.
Yes.
So what I was telling is, it is not something that you have to plan your next 20-30 years of whatever way you're going to practice pathology. You have to plan it from the day one of your residency program. That is the first 3 years. So based on that, if you have a goal of what needs to be done, what you actually want to be at the end of the 3rd year, you have to plan it from the first year, the first day, and the first time when you enter into medical school for a pathology residency training program. So your options, basically options are very, sometimes they are very watertight and you can't move from one option to the other, and moving from one option to other sometimes gets very tricky and you get confused in the process. So you need to understand what are the options that you have once you finish your MD. So what you need to do during the MD to gear up for the next 20-30 years of your practice, I will come to that in a bit. So post-qualification, you need to further qualify yourself with an additional degree. That's what many aspire for. So the way you get it is either in the form of a fellowships. A lot of fellowships are available. And fellowships, I'm going to talk in the context of India and context of outside India, what are the options that are available to you. And if you want to pursue any fellowship, you have to be focused on one particular area, which is your focus of interest. Once you develop that, you have to plan for different types of fellowships that are available in India. There are few fellowships which are available in few centers, which are very high advanced centers, which I'll come to them in the next few slides. And fellowship is one way, and you have them some in India, and you have some of the fellowships which are available. The fellowships that are available outside of India are more, and the options are more than what we have in India, because our system is not yet that mature, not yet that advanced to have that many fellowships. So in India, very few centers, very high-end institutes, they have offerings for fellowships in different specialties of pathology. That I'll come to in a bit. And that is one option that you have. And the second option is somebody wants to get into an academia. The academia is into teaching institutions. For that, what you need to do is post-MD, you have to do your 3 years of senior residency, or you have to qualify yourself with an additional DM degree or a DNB, so that and a subspecialty that will be counted as your experience in senior residency, and that will make you eligible for getting into a junior faculty in area of the government-based hospitals or colleges. So the other third option that we have is to do a practice. So one is private practice, and the second one is in the big bad corporate world. So how each of this will pan out in the next few slides, I'm going to discuss each of them. In India, what are the options that you have? I mean, feel free to stop me, because there's not much of slides to, it's all based on experience, based on some observations, which I felt like I need to pass it on to the younger generation, so that they'll be much better and much prepared for what lies ahead for them. So the fellowships mainly in oncopathology, and you have few fellowships in few centers for hematopathology, and you have PDCCs or post-diploma certification course for nephropathology, or in fact you can have in cytopathology. There are few institutes which are offering that also. So there is a fellowship course for neuropathology, and another new emerging fellowship is in the field of molecular pathology. Now, molecular pathology is a very wide gap. And without molecular pathology, the practice of pathology is going to be very suboptimal going forward. So one needs to have a very good backing of any molecular pathology department, without which the lab or the pathology department is incomplete in going forward. Because these days everything has become targeted therapies. The entire pathogenesis is being studied at a molecular level. So many markers are getting evolved in the molecular domain. Molecular pathology.
I think, sir, one participant raised his hand. He wants to ask a question.
Please go ahead.
Please, sir. Dilip
is there a I think you forgot this GI and liver pathology in this list.
Yeah, you're right. And there's one GI and liver pathology fellowships also offered in few of the institutes, where they do a lot of liver transplant work. And yeah, that's also, there is one possibility of GI pathology and transplant pathology. Transplant pathology, there are a few fellowships that are available. And that, I think, more or less finishes the list of options that you have for fellowships in India, which are offered by few institutes. Molecular pathology, as I was telling, it's just an evolving area, which there is a lot of scope when you are especially practicing in a big institutes where there is advanced infrastructure for pathology services. So coming to the fellowships that you have outside of India. So the preferred destinations are usually United Kingdom, where you have established programs like Fellow of Royal College of Pathology, MRC Path, which is now, I think it's called as MRC Path. And you have fellowships, so many of these fellowships are available in US, and fellowships are available in Canada, Australia, and New Zealand. And UK, now there are actually a lot of openings in UK, because a lot of pathology, especially openings are there. But again, getting into that stream, one should be aware of what needs to be done. Earlier, it used to be PLAB, and then they will ask you to appear for part 1 and part 2 of MRC Path exams. And then once you clear that, you need to go there for a practical examination for part 2. And then once you get into that, then you will end up with a job of a pathologist in some hospital or some medical school attached pathology laboratory. So USA, again, as with any other specialties, it starts with you have to apply for your residency program, Again, after that, you have to choose MLE, and after that, you have to choose your specialty or fellowship of choice, and then you have to get into MD Pathology. Again, you have to redo the whole thing what you have done in the medical school. And Canada, Australia, they have different medical boards, and there are few advantages in places like Australia, Canada, and New Zealand is that there is a provision, now there is an increasing scope for pathologists from countries like India, and where there are opportunities in their countries. What they have created in their system is that they will assess your qualifications on whether it is on par with the kind of training that happens in their country. That's called, equivalence, degree equivalence parameters that they will work out, and then see the kind of experience you have put up, the kind of publication work, with the kind of hands-on work or training or a special training that you have. They will score your entire, your virtues, what you have gained as a part of the training. And then once after that, if they feel that your training is equivalent to what they offer as a fellowship program in their countries, then that will be in a special pathway. It's called as a specialist pathway, especially in the context of Australia, I can tell you for sure. And more or less, New Zealand also follows the same. And what they have is called as a specialist pathway. You need to submit all your training documents, your anything that adds up to your CV. That includes your publications, that includes your different kind of training that you have, hands-on experience. For example, you've been trained in a molecular pathology, you should be doing it with hands-on, or a flow cytometry training, or a immunohistochemistry training, or a tissue microarray training, or whatever. Certain procedure that you need to be very familiar with. So cytogenetics for that matter, or molecular pathology. Then if you are trained in few things, that will add up to your CV. What I strongly suggest and advise to the faculty members of all the medical school is to make it as a part of the curriculum during their residency period, that at least they get to rotate 3 or 6 months, a good period of 6 months, different institutes. They can talk to the faculty in the institutes and have a education program, or what do you call, student exchange program or something, and then get them exposed to the kind of technologies that are available in those kind of institutes. And then if the talk happens at the faculty level, then things will become easy for the students, and then go and get trained in all those aspects, so that they'll be better equipped to apply for these kind of fellowships. So there are the other pathway that some of these countries adopt is that you need to take their exams again, just like UK pattern. You need to appear for their exams. UK doesn't have any equivalence, equivalence of degree equivalence with your whatever happens in the other country. That kind of program, I don't think that UK has got it. Even US also. US again is a long haul. Again, you have to go back to your basics of medical school, and then look for fellowships. You have to go there and redo the whole residency program, and then only you can qualify to participate in any sub-fellowship program. So Canada is also again more or less like UK pattern, and Australia and New Zealand, they have a similar kind of offerings for fellowships. So in that, what we would actually suggest is to get that publication, as I told you in my last presentation, that you need to be focusing on some publications, and you should have a good number of publications. There are again different types of publications. It's just literature search and doing some retrieval of data and doing that kind of publication will not carry that much of weight than what you actually do hands-on. You have to do something hands-on. It is always good for the faculty to encourage people to do something hands-on for their students. And that is one way. That is one way of doing your post MD qualifications. The other way is there are a few DM programs are also available. Now I think there are a lot more institutions which have started offering DM courses in different things. And one such course which has started very early on is hematopathology. I think now AIMS is the only one which is offering it. No, PGMR has also started this DM hematopathology, and they have started DM in histopathology also. One must be wondering what additional things that they'll be taught in DM programs. It's a very good curriculum that I've actually designed. coming to hematopathology part, it is going to be 75% of the training is going to be in the laboratory hematology, and 25% you will be rotated into clinical rounds, and you get to see the patients, the OPD, and you will have a mix of AIMS is that way unique, where you have DM in hematopathology and DM in clinical hematology all under one roof of a department of hematology. And in DM clinical hematology, what happens is 75% will be on the clinical side and 25% will be on the lab side. The same thing will be reversed for a DM hematology program. So you will interact with the clinical side. You get to see the patients on the clinical side. At the same time, you'll discuss sitting in the laboratory and because hematology is such a subject where you need to have a proper lab and a clinical correlation more than any other specialty. So histopathology has recently started one in institutes like PGI. I think that's the only one which is actually giving histopathology as of now. And there's one DM neuropathology also, I guess, in NIMHANS, because it's a very, very, very highly advanced institution. Probably, I think they also I think they have already started that. And the other DM that is likely to come is DM in nephropathology. And probably somewhere down the line, DM in gastro and liver pathology also may evolve going forward, because the number of liver transplants are happening way faster and higher now. So these are the kind of specialties that one can plan once you feel. Probably by the end of 3 years in the for the first year residents, by the end of 3 years, maybe a couple of more DM programs also may be in the pipeline. At some point, there will be a hidden interest or hidden fancy that there might be a chance for any of you to jump into the clinical side. If you are a person of that type, then you still have a possibility of doing that and jumping into the clinical side with only one possibility of doing a DM in clinical hematology. Mind you, that again is only offered by few institutes where even the pathologists are eligible to appear for this. These institutes are one in CMC, Vellore. I think still they are continuing, pathologists to be eligible for sitting for DM exam. And the other institute, I think there's one in West Bengal University of Health Sciences, NRS Medical College, and there is one in CMC Ludhiana. So these are the places, and there are a few other places which are offering DMB clinical hematology post pathology. That is again, DNBs are there in Gangaram. DNBs are there in one hospital called Sahyadri Hospital in Pune, and there's one in Bangalore. I don't exactly remember the name of that. I think Dr. Sharad Damodar is the one who runs the program there. And they have quite a few number of institutes and hospitals offering DNB clinical hematology for even pathology.
Sir, 1 minute, sir.
Yeah.
Sir, I think recently, I mean, MCI has removed MD pathology as eligibility for DM clinical hematology, no, sir, recently?
No, I recently also I met somebody who said that even pathology specialty is also eligible even in CMC Ludhiana.
Oh, but there was a talk sometime back that they have removed the MD pathology from that list.
I need to check. that. And students, you mean you get onto the site and check it.
Okay.
And CMC is still offering it.
Oh, still offering it. Okay.
Yeah. So I mean, I recently heard that Ludhiana is also offering for pathologists. Okay, that again is one of the options that are available for pathologists. Next is suppose if you want to get into academia and work as a faculty, you need to have your senior residency there, because I think that is the most qualification that is actually required before you become a junior faculty. You need to finish your 3 years of senior residency. So academia again, it's a cycle. It all depends upon individual choices what they actually wanted to do. And academia again, you have to choose which institute, which hospital, which medical college, and all that. And depending upon your area of interest, what kind of work that hospital or institute is famous for, and all that, that is again your choice to pick. So this is a straightforward option, and somebody who is interested in continuing teaching, the only thing that they need to focus is on reading a lot of literature and publications and all that stuff is going to help, because at the end of the day they're going to teach, and at the same time they'll be practicing as well. So academia is outside India. If you want to get into academia, like any other places that I just mentioned in few previous slides, you need to follow and do the again training programs there, residency program or a fellowship program. Then you will become eligible to get into faculty there. And few of the institutes like in UK, you have something called as a tier 3 fellowship or this thing. So in that you have an eligibility to get into that program. You can always work there, but you will be restricted to that particular hospital or university which has actually offered you that. So that again is going to be restricted. Somebody wants to go to UK based on that tier 3. You go there, you work in the hospital, and you can figure out and what needs to be done on your side if you want to get into some other county or some other place other than what we have initially been offered. So these kind of openings are available. NHS, a lot of pathology openings are available, whereas the clinical specialties NHS these days is not so great, because NHS system itself is not doing very great these days. Pathology openings are far too many. They have a huge requirements, and the UK is a good option. At least work-life balance will be there. Unlike in India, you have a great work-life balance working in all these countries. So that is one good factor there, especially for pathology specialties, because being a non-clinical pathology specialty, you will have a lot of very good standard of livings and work-life balance. So that again is an individual choice where you want to. And then one good takeaway is that you have to start, planning from day one after you enter into your residency program. So it's going to be a build-up for the next 3 years, and you are going to be equipped with what needs to be done for your future. So yeah, now it's a big area of practice. Anybody? So it all again is an individual choice. If you want to do a private practice, by private practice I mean you want to start on your own. So what is not taught in medical schools is that how to start a laboratory of your own. So that is a huge lacuna. And people are totally, once they come out of the training program, and then they feel clueless as to what to do next. Suppose if you are not, there are very many pathologists are actually passing out every year. And I believe that I think about 18-19 students pass out every year with MD pathology in not only in Andhra Medical College, probably in Usmania also. So with that kind of people coming out, not everybody will be lucky enough to get a job in a government setting or in a corporate setting or something. You need to, again, one big dilemma that the pathology student will be at a crossroads for is to get into really a private practice or not. If he has to get into a private practice, just after finishing his 3 years, he'll be totally ill-equipped with what, because he is not trained, because he doesn't know what to do next, unless nobody is not being given. I've seen many of those kind of situations. Then immediately he is clueless where to go, what to do. Suppose he comes from a small district, his idea will be, let me go to the place and start a lab. But what to start, how to start, and what are the parameters that he has to be trained in? Not only pathology, you have to get trained in other aspects of running a laboratory, which these are the things which no medical school actually teaches. It's high time that gets incorporated into the curriculum and make these people aware. Because after MD, they just come on this thing, and then they get so totally cluttered and totally clueless as to what to do the next. So what I suggest is establishing a private practice will be defined by a lot of metrics. Some known, some unknown. It all again depends upon where you want to practice. There are a lot of different dynamics that are at work. If you want to practice in district level, if you want to practice at headquarters level, if you want to practice in a town, practice in a city, practice in a metro, different dynamics are at play. And all these things one needs to be very much aware, because they have to make their career choice at the end of the day. And these are certain things that one needs to keep in mind. And how to conduct a private practice, how to run your lab. Management is a huge thing. How to make a cost-effective testing service is again a huge thing. These are certain of the things that quality maintenance and quality assurance programs, having an understanding of that. I think all this, it is high time to get incorporated into the curriculum so that they are better equipped, and at least they will have a clue of what to do once they pass out. So I'm sure there will be a lot of queries around this, and I would like to have those queries one-on-one rather than having to discuss them in bulk. So again,
someone wants to ask questions, sir. There is a hand. Mohammad Taha Ali Khan.
Please.
Yeah, hello, sir.
Yeah,
Sir, when it comes to hematopath, is there any significant difference between fellowship and DM?
As far as qualifications are concerned, qualifications are qualifications, but what you're going to do with the qualifications is more. So
Yes, true.
as long as you get a fellowship, it doesn't matter whether you are a fellowship with a DM or a fellowship of 2 years in an institute where there's a very good active hematology work happening. Ultimate objective is to get a good understanding and training of the subject. But who cares whether you are a DM or a fellowship in hematology or obtained from a place where there is a decent, good training of hematology. Qualification is qualification. And what you do with qualification is more important than the qualification. You understand?
Yes, thank you.
So it all depends upon your ability to do what you do with the qualification.
Yes, sir.
So if you're a fellowship program, there is a very good curriculum where you get to expose to all the high-end gadgetry, cytometry, molecular stuff, and all that. You are very well equipped, and you are more than qualified to be called as a hematopathologist. So you don't have to, think too much about whether I'm a DM or a fellowship or a non. No, you don't have to think too much. As long as you are very good in your subject, very good subject and understanding the knowledge comes with your training. The training again is dependent upon the place where you are getting. And the fact that you are training. These are the things which matter most than the alphabets in the things. You understand?
Yes,
so don't give too much importance to the qualifications as long as you have a good training. Even for that matter, an MD pathology who is trained in a lot of recent advances is much more than anybody who's got an additional alphabets as a qualification.
Yes.
So you have to take it that way. And my focus should be on your training, not on the additional qualifications that you're going to require. Yes, qualification. Definitely, they're going to help you in few places. Unless there may be institutes. I don't see any institute which has a qualification and the training is very poor. So far, that has not been the case. And that must be happening in a lot of clinical specialties, especially in surgical specialty. They may be having an MCH degree, but they don't have enough work to offer to the resident. So those kind of possibilities are there for surgical specialties. But pathology, I don't see any place where they have a very good qualification to offer and very poor training to offer. So don't bother about whether it's a fellowship or your degree, or it doesn't matter. It doesn't matter. But I mean, what matters is how much of interest that you have, how much of passion that you have for any specialty of pathology, and how you pursued it, and how you can solve a day-to-day problem is that what matters most than anything.
Yes, very true. Thank you.
Qualification will open the door for you, but what you do after getting into the room is entirely on you.
Yes.
So again, most of the residents will be clueless as to what is going to be the kind of practice that you can come across in things like corporates. There is a general assumption that you get highly qualified and then big corporate hospitals are going to offer you a very good salary and very good position. Let me tell you, it is not going to be like that. For most of the younger generation who just wanted to, are dreaming of doing some fellowships and higher qualification, they're good to do. But don't come out with the expectation that corporates are going to open invitations and that kind of expectation one should not have. What actually corporates are they're more focused on the commerce than the science. Most of it. If they have a very good, decent, some hospitals are very focused on transplants and liver transplants and all that. Yes, they require expertise. But in general, most of the corporates, especially in tier 2 cities and any other place, they look at people who are more like generalists. They don't have to have a specialist. So this is one point I would like to underline again. And then it doesn't mean that one should not be showing interest towards higher qualifications or acquiring newer knowledge and newer things in pathology. It has to be. It's a two-way process. You need to acquire that too, and at the same time, you have to secure a job for you as well. So for anybody to secure a job, you need to have a generalistic attitude and approach towards specialty. Doesn't mean that once you are specialized in something, you need to do only that. No. So you need to be a generalist first, and then because these are some of the specialties which are actually evolving very recently. They have not started way back, 20 years like any other DM specialties in clinical this thing. So these are some of the specialties which have recently started. If you go to any corporate hospital, how many of them will be DMs? They will all be MDs. You need to work with some senior personnel, senior staff. So they also have their experience behind them. So it is very, you need to have an open mind when you want to work in corporate. They would like to have a generalist than a specialist. Yes, they'll be happy to have a specialist, but at the same time, they want a specialist to cover the generalist work as well. So that you need to keep in mind. Don't lose touch in all the specialties. In fact, there are actually 5 specialties in pathology, in practical pathology. Leaving aside your morbid pathology, forensic pathology, which is of not much use actually in clinical practice. So you have to have immunopathology, and immunopathology covers your transplant immunology also. That again is a big area. And cytology, you have histopathology, hematology, and clinical pathology. So, I mean, pathologists are the boss of the laboratory, because even if you look at accreditation, this thing, what your pathologist is eligible and qualified to do all lab work, basics of all lab work, including the molecular. So it becomes an insufficient training if pathologists are not, having a training which is end-to-end, which covers almost all aspects of pathology specialties. That includes molecular, that includes cytogenetics. There are a whole lot of institutes are offering programs in cytogenetics, for that matter, even in immunology also. HLA typing, HLA lab facilities are available in some good places. They offer very periodic training programs. I think the students should be encouraged to attend all of them, and then as a part of the curriculum, and give a good time of 6 months, and then have a rotations and get them exposed to all these high-end technologies. In fact, they're not high-end; they're already there in good institutes. It just takes time for them to percolate to tier 2 city medical schools and colleges and hospitals. So corporate again is a different kind of a practice. So I think I think this is the last slide. And I mean, if any questions, I'm ready to answer them, but I need a little more participation from postgraduates, because unless you ask me, it won't strike me that I need to address these two. So let us have a very active discussion on this. Yeah, go ahead.
Yeah, now it is open for very thorough interaction, which our speakers are also wants. So I request all the participants, especially postgraduates and everyone, to please come forward and ask their questions and interact. Yeah, you can just unmute and ask the question, no problem. Anyone?
Yeah, hello, sir.
Yeah, go ahead, please.
Please.
Sir, actually, I have finished my post-graduation.
Okay.
How will be the scope for DM oncopath, sir, after in corporate side?
Corporate, yeah, very good question actually. It's always good to have additional qualifications, as I told you. But what you need to plan, especially when you're doing a DM degree or something, it all depends on where you want to practice. After, yes, you have acquired your qualification after 3 years. Then you have to think who is going to employ you. Okay, number one question. Let us look at it as a 360-degree view. Who is going to offer a DM oncopathology job? Then immediately what comes to your mind is there are few oncology centers. So it all depends upon where you belong, which city you belong, how many oncology hospitals are there in the private sector.
Yeah, Upendra sir.